Eventually, by just moving 8 miles, I did find a service that could help me. It was a Turning Point service in Whitby Bay where I lived, where they had a structured daycare service, and that's just what I needed, somewhere to go. I liked a commitment a day. Every day I would have an appointment. That was my reason to get out of bed, to go and busy. And it was just going down there, having chats and going to the gym. And after a while I thought, well, I would like to help other people go through it with alcohol problems. So I stuck in. And after the mandatory 2-year rule to go into voluntary work, a load of rubbish, I started voluntary work. And I also came involved with the Regional Drug User Forum. I got involved with the Drug User Forum not because I was using illicit drugs, but I wanted to bring the issues of alcohol misusers to the attention of the National Treatment Agency. We've got Lynn Duggan there now, she can look after us, can't she? But in a short while that was soon ended. The NTA found out I was alcohol, and the substance alcohol was not a substance that they wanted to work with. So anyways, that scuppered. I got involved working alongside a user involvement worker with North Tyneside Drug Action Team. And within a while, the same thing happened. I got a group of people together, and the Joint Commissioner came down, and she was horrified to see that it was all people with alcohol problems, so that was shut down as well. And at the same time, my solution, Turning Point, was closed down by the same Commissioner. And to get a venture like this up and running, if I'd have been setting this up with drugs and alcohol, funding would have been much more easier to access. But why? There's enough out there for drug users. It's services for alcohol misusers that aren't present. So what happened then? It was a case of going round knocking on doors, asking service managers if I could use their premises free of charge to start support groups. And in March 2004, Necker in Gateshead, we opened our first group. We now have 5 in Sunderland alone. We've got Newcastle, Gateshead, Durham, County Hospital, Darlington. And it's like we started an epidemic. Everybody wants NERAP. One person that's been very, very instrumental in helping me get NERAP up and going was Peter Carling-Page, formerly alcohol coordinator for Sunderland Teaching Primary Care Trust. He's been a tower of strength to me, told me which doors to go and knock on. He never did it for me, as some people think he did, but no. But he's been great. But there's lots of other people being fantastic as well, with the little bits, you know, the little words, little letters, use rooms free of charge. It's all adds up, and sometimes I wish I could go on Who Wants to Be a Millionaire, because the people I've got from iPhone are friends, they're great. Well, I still didn't have any money, but slowly it started to come in. £1,000 here, £5 grand. Our total income last year was less than £14,000, and we did all that. And we're so successful because we partnership work. We've never set up alone, we've always gone knocking on doors, including others. That it has to be that way. We see ourselves as the complement to other services out there, that we take over where they finish off. I remember last summer, Clive Henn, the alcohol lead from the Department of Health, came up to have a look at NERAP, and it was a lovely summer day. We stood on the steps at Necker in Sunderland, lovely sunshiny day. There's myself, Clive, Peter Carling-Page, a couple of nurses, and then we just wait for a photographer, and a seagull comes along and deposits its breakfast on me. And but anyways, it must have been for luck. So what we got now, the Community Alcohol Misuse Project. It's changed everything for NERAP. It's changed everything for me because I got a job. And thank you, Management Committee. I have to be nice to them now because they employ me. I remember getting a phone call from Pat Harriman, and it was about waiting lists in Sunderland, and from that developed a meeting with Peter Carling-Page. From that we identified that Hendon was the area of the city most affected by alcohol misuse, and from which has developed the Community Alcohol Misuse Programme. we hope we are providing here is a solution, just one solution. There needs to be many, many more. It's about treatment with aftercare. We're trying to reduce the numbers going through the revolving door system. But it goes further than that. It's about education. It's about us going out in the schools and colleges and workplaces of Hendon and the East End. And it also includes mentor training, because we want people that have been affected by alcohol misuse to get things sorted and then come and get involved with NERAF more. It's a unique partnership working between us and Sunderland Teaching Primary Care Trust, which thankfully back on the map are funded. But it goes further than that. It's also a partnership with Wearside substance misuse teams, job linkage, the probation service, the health trainers, schools, youth clubs, because one organisation can't do this alone. We've all got to come together to be able to do the best for our communities and our people. Sunderland have been fantastic in supporting me behind this. And I've met many nice people while I've been working, particularly along the detox nurses, and we've got Angela here today who's going to be our detox nurse at Angel House. And what we're going to see is people like me that have been in treatment, working with Angela, visiting people at home while they're receiving treatment. And then it's back to the mentors, or the peer support, taking people through the early days, getting them to know themselves together. We now have a women's only service because of Wearside Women in Need. You know, Wearside Women in Need notified us that, you know, there was problems with alcohol within their establishments, and we've set a service up in there. Now that service will stay within Wearside Women in Need because it's a safety zone for the lasses. But in a few weeks they're running down the road to join in the mixed group as well. So, but what we want to do here is build a 7-day relapse prevention and aftercare centre. I would like to see it developed across the city. I would also like to see it developed nationally because it's needed. The North East has a serious alcohol misuse problem. We abuse it more than anywhere else except the North West, and I'm from the North West. We have fewer agencies, longer waits. But this project, on the back of the North East statement of priorities, is the North East taking the initiative. The North East is leading the UK. I work all over the country now